Hello, my dear doctors. We're going to continue with the MRCP basis um, examination, and today I'm going to talk about the neurology station. So, I will like to divide the neurology stations into few sections. So, mainly going to talk about the spot diagnosis in this. So, there are some cases which are quite obvious once you enter the station, and they are typical facies or typical um, appearances that will lead you to the diagnosis. So, these are called the spot diagnosis. One of the case which I see quite frequently comes in neurology station is myotonic dystrophy, and we're going to talk a bit about myotonic dystrophy today. So this case, myotonic dystrophy, is the look and approach case. So once you have seen that you think that the patient got myotonic dystrophy, and there are particular facial appearance of these patients, then you should do a focus examination. Normally, maybe they will give you some hint that the patient dad died during surgery, or there was difficult anesthesia. Coming out from anesthesia was difficult for the patient. Okay, so once by the focus examination, I mean, obviously, first of all, we're going to do the inspection, and you look for a typical myopathic expressionless face. As you can see here in this picture, the patient expressionless face, and there is some wasting. On the face, you also look for any frontotemporal balding. Um, Ask the patient to close eyes tightly and open, and you will see that there is some delayed opening. It's called myotonia, and formally chest for the muscle strength on the face. So these are the things which you see on the face. And then you proceed to do the upper limb examination. The shake of the hand, when once you enter, it is courteous to shake the patient hand, and at that moment you can feel that the release of the grip is a bit slow. We ask the patient to make a fist and release it, and it will be slow movement. Moving on, we can do for the percussion myotonia demonstrate, we tap the thenar eminence, and here you can see, just use your tendon hammer to tap, and there will be some flexion of the fingers. So this is called percussion myotonia. And grip myotonia, I already told you. So mainly is a combination of distal weakness and myotonia. And finally, you check for the upper limb, there will be absent reflexes. So examination of the face, obviously inspection, look for the myotonia in eyes, examine the muscle strength on the face, and then move on to the upper limb examination. Okay, so how you will present this case? So you will do the presentation the same pattern how you have did your examinations. Like, first of all, we can start by, on inspection, I notice the patient has myopathic facies. Further, you will elaborate that patient has frontotemporal balding, there is bilateral ptosis of eyelids, and there is wasting of facial muscles. Along with it, I also notice patient has wasting of the muscles of hands. On examination, I notice patient has facial myotonia, grip myotonia, as well as percussion myotonia, which I have demonstrated. I like to do the full neurological examination of the patient and to examine the other systems for possible complications. So this is how your presentation should be in this case. Try to be systematic, mention your findings on inspection and examination findings later. Few questions which can normally asked in these stations. The most popular one, what are the complications of the myotonic dystrophy? So here it's good idea to divide it into different systems. Like patient with myotonic dystrophy, they have cardiac symptoms. Cardiac mean in the cardiovascular system, the patient may have an arrhythmias. They can be heart block, cardiomyopathy, and mitral valve prolapse. Then the other system which could be affected is the endocrinology, and in endocrinology, patient can have diabetes, hypogonadism, thyroid disease. Respiratory, we have hypoventilation, and patient may have a frequent infection. And in the GI, patient may have a constipation, diarrhea, and some abdominal pain. So just divide into systems and step by step give the examiner answer, so the examiner also feels that you are more systematic. Okay, so another question which is frequently asked, how you diagnose the patient. So mainly it's a clinical diagnosis. Patient may have a positive family history and we have presence of myotonia. EMG can be done for the confirmation of myotonia, and genetic testing can be done for the diagnosis of myotonic dystrophy. What about the inheritance? They are commonly asked, and we should know that this is an autosomal dominant condition, and patient has trinucleotide repeat in myosin protein kinase gene on chromosome 19. So, my dear doctors, this is all about this case, myotonic dystrophy. You can do further reading by looking the Oxford Handbook of Medicine or whatever reading material using. But these are the main questions which will be asked, and you are expected to be systematic. And if you follow these steps, the station will not be difficult for you. Thank you very much, and I'll see